Hi guys, welcome to your IVF Teach class. My name is Michelle if you haven't met me already. This is how you will probably see me from now on until things get more normal so I can speak to you. So this is going to be your virtual Teach class. I'm going to go through everything in this video. If you have any questions, you can email me, you can call me. Normally when we would have a Teach class, you and your partner would come in and I would give you this nice little folder and go over everything in it. I'm going to make a way so that you can find these all online, but again, I'm gonna go over everything with you. So normally, the first packet I would go over is this one. It's just the general IVF packet. It goes over your pre-cycle requirements, the preparation cycle, which you're all in now, and also, the process, the procedure, and then the medications you would need. So in regards to your pre-cycle requirements, basically most of you have completed everything that is needed. Otherwise you're not able to start. So if you don't already have your pre-cycle requirements done, I will let you know, and then we'll go from there. As far as your preparation cycle, that's what you're going through now. So to prepare you for IVF, we need to make sure that your body's not starting a new cycle. So that's why you're on the birth control pills. It's not to shut off your body, it's just to pause you so that once we start you on your IVF treatments, the medications will respond appropriately, or your body will respond appropriately to the medications. So eventually we're gonna have you come in for your suppression check. So that's gonna be an appointment for blood work and ultrasound to make sure that your hormone levels are low and that there's no large cysts on your ovaries. So if there happened to be a large cyst on your ovary and it was producing estrogen, you just wouldn't be at the prime time to start an IVF cycle. So we would let you know at that appointment. That appointment would also let you know if you are ready to start. So if you come in for that appointment, your hormone levels are low, there's no large cysts on your ovaries, then you would be starting IVF medications that week. So in regards to the start of IVF week. So when you come in on your suppression check day, we'll go over everything with you. If you need any refreshers on how to do your medications, we can do that with you. But as far as the start of your medications, depending on your protocol, you will start medications someday that week. We will be super specific with you. Usually people will start medications on Friday, but with everything that's going on now, we might have to do things a little different. So I will give you a protocol sheet that will give you exact instructions of when to start your medications, and you are going to take them daily. Now, these are all injectable medications. You're gonna start them, let's say you start them Friday, you're gonna start them Friday and be on them daily until we tell you otherwise. You may be taking them once a day, you may be taking them twice a day. I will be super specific with you. So again, you're on these medications for 8 to up to 13 days. While you're on the medications, we need to monitor you about every other day. So we'll make appointments for you for Monday, Wednesday, Friday. It may need to change, but again, we will let you know. So your stimulation cycle will start the day you start the injectable medications, and you will be on these injectable medications daily for 8 to up to 13 days. Usually the average is about 10 days of medications, but we won't know until we see how you're stimulating. So once you're on the medications, we'll need to see you about every other day. So we'll see you Monday, Wednesday, Friday. We may need to add or take away days. We will let you know as you're going through the stimulation cycle. Those monitoring appointments will again be blood work and ultrasound. The blood work is to measure your estrogen level to make sure it's rising, and then the ultrasound is to measure those black circles on your ovaries. So those black circles on your ovaries are fluid-filled sacs, aka cysts. Eggs are microscopic, so if there's an egg in them, they are termed follicles. We just call them all eggs because it's easier to do that. So when you come in, we will measure every black circle. Not every single black circle will have an egg in it. We wouldn't know how many eggs are in there until your egg retrieval day. So when you come in for ultrasound, you will hear us, measuring. Dr. Levi or Catherine will say, numbers like 10, 12, 13, and one of us will be writing those numbers down. So each time you have an ultrasound, you will have blood work done to measure your estrogen level, and we will call you every day after your appointment. If you do not hear from us by 4:30, Monday through Thursday or by 1 o'clock on Friday, please give the office a call. We do need to speak to you, or you do need to get a message from us. Generally, if we do call you and you do not pick up, we will leave a full detailed voicemail. If you have any questions about anything, please call back and ask for myself or Catherine. But when we do leave a message, we do ask that you call the front office and let them know you received it, just so that we know we're all on the same page. So as far as your monitoring appointments, that is what will go on. As far as your last monitoring day, that is when we will go over your last shot of the cycle, which is your trigger shot. We will go over how to mix that and the exact time to inject it. I will also give you paperwork that day. As far as your egg retrieval day, we do not know that day until 2 days prior, so your last monitoring day. So your trigger shot would be taken 36 hours prior to your egg retrieval. So if you come in on a Tuesday and you are ready to go, your egg retrieval would be on a Thursday morning. You would take the trigger shot Tuesday evening, you would be off Wednesday, and then come back to us Thursday morning. Again, we will be super specific with your instructions. If you ever have any questions, please ask them. There's no such thing as a dumb question. As far as your egg retrieval day, everyone usually asks, how much pain they'll be in. Everyone is different. Usually we say it's a little bit worse than a period in regards to the cramping and discomfort. Depending on your treatment course, you can either take Tylenol or Motrin if you are a frozen transfer. Again, I will go over all of your medication instructions after your egg retrieval and let you know what you would be starting. If you are a fresh transfer, the night of egg retrieval, you would get started on 3 oral medications. One would be doxycycline, which is an antibiotic. We use it prophylactically just because Dr. Levi is going through with a needle just to prevent any infection. The second medication would be estrase or estradiol, and that's just an estrogen supplement just to keep your body going until your body picked up and did its own thing. The third medication would be Medrol or methylprednisolone. It is a steroid. We use it basically to lower your immune system just a little bit so that when we put the embryo back, half of the embryo cells will be your partners. So we use it in a way to kind of prevent your body from attacking the embryo. The morning after egg retrieval, you would start 2 other medications. One would be over-the-counter aspirin, low dose, which is 81 milligram. And then you would take a vaginal progesterone supplement. I will go over whichever one you have. There's 2 different brands. And then you would come in for your transfer 5 days after your egg retrieval if you are a fresh transfer. If you are a frozen embryo transfer, the only medication you would start the night after your egg retrieval would be doxycycline, and then you would call us with your following period. If you're a fresh transfer, again, your transfer would be 5 days after your egg retrieval. We will go over all those instructions with you, and then we'll go from there. Again, if you have any questions at any time, please let us know. If you are a fresh transfer, 9 days after your transfer would be your first blood pregnancy test, and then we would go from there. In regards to your egg retrieval, so on egg retrieval day, you will come to our office at the specified time, you and your partner, and I would bring you back to the changing area. You would change. I would have you speak with Dr. Levi, make sure everybody's on the same page, and then you would speak with our anesthesiologist. You would sign consent forms with them, and they would place an IV line within you. The medication we use here for anesthesia is propofol. A lot of people know it as Michael Jackson juice. Michael Jackson was not monitored. You will be monitored. You will have heart monitor leads on. You'll have oxygen under your nose. You'll have people in the room with you. This is not considered a surgery. You are not intubated. There's nothing going down your throat. It's an in-office procedure, and we use the most minimal amount of propofol that we need. The procedure itself is 15 to 20 minutes, so it's not that long at all. Once you're done speaking with the doctors, we will bring you to the bathroom to empty your bladder, and then we'll bring you back into the procedure area. The procedure area looks just like you're going to get a pap smear. It has stirrups. The stirrups in this room, though, have Velcro boots around them. Obviously, you will be asleep, so we need your legs to be stabilized. In your, what would have been your folder, will be this paper, and it just shows you over here how the IVF is done. So basically your ovaries lie on either side of your uterus. What Dr. Levi will do is use the same kind of transducer you've gotten your ultrasounds with before, except this time it'll have a needle guide on it. So he will make a small puncture in the side of your vaginal wall, and with that needle, he will go to your ovary and draw out that fluid that's in those black circles. As he's doing this procedure, the tube with the fluid gets brought right over to our embryologist, and he checks under a microscope and he counts how many eggs there are. So again, the procedure is 15 to 20 minutes. Once you're all done, we will bring you out to the recovery area. Usually people are up within 5 to 10 minutes. Once you are up, I will give you a snack. If you have any dietary restrictions, definitely bring some food with you, and then we will give you something to drink also. Once you're up and eating, then we'll bring your partner by your side. And then by that time, Dr. Levi and our embryologist, Dr. Kloos, will be done counting the eggs, and Dr. Levi will come and give you the result of how many eggs that we received. In regards to fertilization of those eggs. So first we get the egg, and then about 1 to 2 hours later, they are fertilized. So there's 2 different ways that they will be fertilized. One way is conventional fertilization, where they just leave the sperm on top of the eggs and see what fertilizes. The other way is called ICSI, or intracytoplasmic sperm injection. That's where they pull up the best looking sperm and inject it directly into the egg. Depending on your course of treatment, Dr. Levi and Dr. Kloos will make that decision. If you are testing embryos, all of the eggs will get what's called ICSI. We do that so that the embryos are not contaminated with other DNA. And then as far as the night of egg retrieval, again, I will go over your instructions for that. The following day after egg retrieval, Dr. Levi will call you and let you know how many embryos you have that were fertilized, or how many eggs were fertilized. And then if you're a fresh transfer, we will keep in touch with you and let you know your instructions for your transfer. If you are a freeze-all, then you would just call us with your following period, and depending on your treatment, we would either put you back on birth control pills or go a different way. But again, we will give you all these instructions. One thing that our lab does is called assisted hatching. So basically what our embryologist will do is make a small puncture in the outer ring of the embryo, and then this basically just aids in implantation. I usually have to tell people this just because insurances sometimes do not cover it. Somebody from billing will go over all of this with you though. If you are a fresh transfer, again, you would have a transfer within 5 to 6 days of your egg retrieval. And then again, 9 days later, your first blood pregnancy test.